Confusion and pushback following the Trump administration's warning about taking acetaminophen while pregnant. Welcome to CBS News Detroit at 5. I'm Terrence Friday.
I'm Shayna Humphreys. The White House says acetaminophen, the active ingredient in Tylenol, may not be safe for pregnant women, but most medical experts disagree. In a major study published last year, researchers followed nearly 2.5 million children over 25 years and found that acetaminophen use during pregnancy did not increase the risk of neurodevelopmental disorders. But the administration pointed to some studies that have suggested a potential association. Now the FDA plans to update the safety label on acetaminophen to reflect its new warning. Still, doctors say the White House announcement is not backed by scientific evidence. Health and Human Services Secretary Robert F. Kennedy Jr. acknowledges that autism research is ongoing.
And after yesterday's warning from the Trump administration, we are hearing from parents who have children on the autism spectrum, as well as experts who say that they're skeptical about those claims made by the White House. CBS News Detroit's Jack Springate spoke with them to learn why.
An autism expert at U of M tells me there's other ways to explain the correlation between pregnant women taking Tylenol and increased risks that their child will be diagnosed on the spectrum, a big one being fevers they claim come with its own increased risks for autism that can falsely be credited towards Tylenol as pregnant women turn to the drug for relief. In a statement, the White House claims, quote, there is mounting evidence finding a connection between acetaminophen use during pregnancy and autism, and that's why the administration is courageously issuing this new health guidance, end quote. However, a U of M autism expert claims this evidence might not show the full picture of what's really to blame.
When they did an additional analysis accounting for siblings, what they found is that the association between autism and Tylenol disappeared, meaning that the association was actually driven by shared genetic risk.
Dr. Mohideen says the reason a pregnant woman might take Tylenol is what could really be behind the risk.
Fever or illness is associated with other neurodevelopmental outcomes. So it might not actually be that it is the Tylenol use itself, but it might be exposure to viruses or other illnesses.
Two Detroit parents with children on the autism spectrum told me they never took Tylenol while pregnant and that they're skeptical of these claims from the Trump administration.
I don't buy it because it is what it is. Like, it's autism. I've learned to embrace it. I've learned to uplift it.
So I never took Tylenol while I was pregnant, and I would advise all parents to follow the instructions of their medical doctor and their prenatal care doctor to make sure that they're being advised right medically.
The biggest takeaway I got after speaking with these parents and that U of M expert is how they feel there needs to be more research done to improve the lives of those already living with autism, and that no one factor is the real cause behind it. Reporting in Ann Arbor, I'm Jack Springate, CBS News, Detroit.